Hello.
Hi, how are you?
That's
Good
Gary,
to see you
my
again.
son.
Yeah, we met before.
I thought you did, yeah.
Yeah, last time.
You're a busy doctor.
I am indeed. I am indeed. How are you?
Well, you know what? I'm still here.
Better than the alternative.
Good answer.
I'm 87 years old, and
Well, hopefully we have a few more years left.
well, thanks to a good doctor like you, you're keeping me here.
I don't think I have anything to do with
Yes,
this.
you do. Yes, you do. So anyway, I am very happy to be here and talk to you.
Good.
And yeah, so far,
So far, so good.
yeah.
Anything to add?
Well, he's hanging in there. He's
Yeah.
you know.
Yeah, good. Yeah, I know last time we were all together, we were discussing your memory,
Yeah.
and I noticed you saw a specialist,
Right.
and he did some testing, and I must say you did extremely well on the memory testing.
Well,
I'm not sure I could do as well, to be honest with you.
yeah, but you created me to be good.
So that was good news.
Yeah.
And then I see you did a brain scan.
You know more about that.
Yeah, and that
You know.
turned out okay.
Well, good.
So, so that's not bad. I wanted to give you some news here, which is good news.
Oh, good.
Now, just a few days ago, we repeated a bone density test,
Okay.
which you had done before, but it was time to update it, and it came out perfectly normal.
Good.
So that means there's no osteoporosis, and that's
a good thing.
That's a good thing.
Yeah.
A very good thing. So that's
You know.
to keep. Now, I wanted to mention to the both of you that we now have a vaccine that is designed to prevent shingles. And it's available and it's recommended for one time only. Do you know much about shingles?
No,
Have you heard
what
much
is
about-
shingles? Is that
It's a condition that affects the skin. It's caused by a virus.
Oh, okay.
And it's very, very painful. If you've ever met anyone with shingles, they'll all tell you the same
Dry
thing.
skin.
No,
Oh,
it's
just-
pain.
oh,
Pain.
no, I-
It causes blisters.
Oh, wow.
And they're painful, and they could last for years, literally.
Uh-huh.
The pain can. So that's why it's recommended now that all of us get a shingles vaccine.
All right.
And again, you only get it one time.
Okay.
Yeah. It's actually the virus that causes chickenpox causes shingles. It's kind
I
of
had those
interesting.
Years ago.
Yeah. Well, here's the problem. The chickenpox virus never left your body. It stays
Oh,
buried
really?
in nerves. And the reason it's painful is it infects nerves. Yeah. So I mention this because if you're interested, I could arrange for you to get an injection.
You are the doctor. If you think I should get it,
I
let's
recommend
do
it.
Let's do
Yeah,
it then.
I strongly recommend it.
Yeah. Do I have to do that today, or can I come back?
Well, we'll do it right, you can do it in the office here.
All right. Okay. You know, see, we learned something, but I really don't.
Did you know
remember all
about this?
Yeah.
shingles vaccine?
My mother-in-law had it, and I'll probably eventually get it because I did have chickenpox at one time.
Yeah, it's the same virus. And as we get older, you know, our immune system drops a little bit. and
Right.
We're more susceptible.
Okay.
So I have some more good news.
Well,
Just see, I'm just full of good news today.
You're a good doctor. You've given me the.
So we did a bunch of labs, of course.
Boy, did we ever.
Yes, we did, and everything looks great. Blood count, which measures the red cells and white cells, that's normal.
Okay.
The blood sugar is normal, so no diabetes.
Can I stop you there just 1 minute?
Yes.
I have a lot of, not a lot, but I get phone calls from this person that I give blood from
Yes.
a blood bank.
Yes, yes.
And I said, I'll have to talk to my doctor if I should give blood.
Oh, sure, yeah.
Oh, I'm glad to hear that.
If you would like to continue, there's
I
nothing in your blood that would prevent it.
Oh, that's right.
Now, if you were anemic, I would say, yeah, we better hold off.
Right.
But you're not even anemic, so yes,
See,
You
that's
could do
good
that.
news.
How often do you donate blood?
Oh, I've been probably a year or two since I've given, but
Oh, okay.
I'm going to do it again. now
Oh,
that-
sure. You
Yeah.
absolutely can. Urine was normal.
Yeah.
Cholesterol was great. We did a vitamin D level. You know, we were talking about bone density. Vitamin D helps to keep our bones strong. So we actually are measuring vitamin D in the blood, and yours came out perfect.
Because I take vitamin D.
Well.
Vitamin.
Yeah.
Yeah.
Keep doing what you're doing.
You're doing the right thing.
That's because we don't know what to do.
We did a thyroid test, and that was normal.
Okay.
Boy, you know, you've been a busy guy, my goodness.
Well, I'm just glad to be able to give you some good news.
Boy, I tell you, I'm glad.
Not everyone I see gets good news from me, I have to tell you.
That's great.
Oh, I tell you, how
Let me
lucky
take your
can I
sweater
be?
off.
How lucky can I be?
Well, you're doing great. So,
Well, it's.
you know the old saying, if it ain't broke, don't fix it. Just keep doing what you're doing.
I still keep going to the gym there. And
Well, I think that makes a huge difference.
I think it does because I can tell my difference in my breathing.
You can
When-
tell.
Yeah,
Mhm.
when I get on that treadmill, you know, let's say for 30 minutes,
Mhm.
20 minutes,
Mhm.
and boy, I tell you, I can tell the difference.
Yeah. Now, I know you have this issue with your heart valve, and I see, you see Dr. Lawrence for that.
Yeah.
But that seems to be stable,
Yeah.
That's good.
so that's good news.
Well, that's. I might be around for another year, Gary.
Might be, yeah.
As long as I have
More than a
doctor.
year.
If I have a doctor like this, I'll be around. I was glad to ask him about that, giving blood, you know.
Yeah.
Because she wanted me to make a
Appointment, yeah.
and I said I won't do that until I talk to my doctor today.
That's a smart thing to do.
Yeah. Oh yeah, I don't do anything. Now I got to ask him how much alcohol I can drink and not hurt me.
Blood pressure's normal. How much do you drink now?
Well,
First of all, what do you enjoy drinking?
Well, I enjoy a little bit of scotch and water,
Okay,
and I usually have that in the evening,
okay,
and with 2 jiggers of scotch and then
Okay,
water,
okay,
and that's it.
okay.
And then if I don't have, if I'm going to the Elks, then I just have beer,
Okay.
light beer,
Okay, okay.
and a can or 2.
How often do you go to the Elks?
I go there, maybe once or twice a week at the most.
Okay. So the day you have the beer, you don't have the scotch and water?
No.
Then I would say that's fine. You can continue that.
Gary, do you have anything to add to that? But that's basically.
Well, the thing is with the amount that he really drinks is that he may forget how many beers that he actually has.
Oh, it might be more than
With
a
a
couple.
with a like the short-term memory loss
Yes,
that was
yes,
indicated, he might think it's just a couple, but
How many do you think it is?
well,
That's if I do it, it's very seldom.
well, I would say that sometimes he'll start earlier in the afternoon and have a beer.
Oh, no.
But if I go over there now, he'll offer me a beer
Oh,
right
And then
away.
he'll have the scotch later on.
Sometimes, yeah.
Yeah, that's possible that way.
Yeah. It's probably better for you to have one or the other
Oh, right.
on a per day rather than both on the same
Yeah.
day.
And I hardly ever start drinking before 5
Because, yeah, the alcohol can affect your memory.
Yeah.
That's why
Oh,
I bring
okay.
it up.
Yeah,
Your
right.
liver's fine, so that's not an issue,
Right,
but it
right.
could affect the memory. It could
Right,
affect
right,
the memory.
Yeah,
and that's kind of one of our concerns
Yes, yes.
there.
Open wide? Yeah, so I would try to limit it to maybe a can or 2 at the
Yeah.
most of beer.
I will say one thing though, that I've noticed, that if he drinks something other than the beer or the
Mhm,
scotch,
mhm.
he seems to have a harder time with it. If he drinks vodka
Yes.
or if he drinks a red wine, red wine,
Mhm.
it seems to affect him more for some
Oh,
reason.
in
I don't
terms of
know.
his mental
Well, I mean, he'll
capacity.
become. It seems
Well,
like he
other than
becomes more
special occasion
inebriated,
On a birthday or something, they're like.
more inebriated kind of
Mhm.
than, you know, and that's usually if he goes somewhere where like maybe that's all they have and they're
Mhm.
serving, you know, like one of the things,
Mhm.
events that he goes to.
He's talking about my birthday party.
Well, that too. I
Well,
won't, I
for
won't
that you
count
can
that.
celebrate.
Yeah. Right.
But during the course of regular events, because I do worry about how it affects the memory.
That's right, and I have
Right.
talked to Dr. Lawrence about it, and I've told him pretty much, you know, that he asked me how much I drank, and I said, well, if I go to the Elks, I haven't had any to drink, and I said, somebody buys me a drink like right now,
Mhm.
so I'll have another one, and I gotta buy him one back, so that'll
Right.
be two.
Mhm.
So
But
before
yours
you know
are-
it, you're kind of forgetting how many
Yeah.
Well,
yeah.
it is,
but
and
exactly.
I can cut, I'll watch that and make sure that it's, that I don't wanna drive.
especially if your buddies come over and you're having a good time and what, you know, I mean, you
And you
forget.
kind of lose track.
Kind of lose track.
We
So-
all do.
So, right, yeah.
When you're having a good time, and you know, you
Right.
lose track of how many you might
Sure,
have drank.
sure.
Try to hold your
Yeah.
breath, please. Okay, breathe. Try to hold your breath, please. Breathe.
What are those things? No, you know what I
We'll
do,
lift your
Doctor?
shirt up.
I take and, I'll wait till you.
Try some deep breaths through your mouth. Deep breath. Okay, good. Relax.
Okay.
Thanks. Now I'll just have you lie straight back, please.
This is about the time I have a nap.
You live with your...
No, I live in Redondo Beach, but I'm only a couple of miles, 2 or 3 miles away.
So he's
So-
living alone.
Yes, and
Is he able to manage himself?
well, we're getting a little worried about some of the things that some of his, he's misplaced his checkbook and, you know, some things, and he gets upset about that, and I'm noticing some things like, you know,
I'm not 35 years old.
right, I mean,
What
it's
about driving?
age-related.
What about driving?
Well, that's another concern of ours. I think, see, the thing about it is what he's used to doing,
Mhm.
what he's very comfortable with, going to the bank,
Mhm.
going to the market,
Mhm.
going to church, and, you know, and places that he regularly drives.
Mm-hmm.
But if it's somewhere new, it's
It might be
it's kind of
confusing.
it's confusing, and I've volunteered to drive him to places to like doctor appointments
Okay.
and places that he's having problems because he had one cataract done. He has some vision issue
Mhm.
that I don't know if he sees the signs or can react quickly enough.
Oh. I guess should he still be driving?
I think that in a close proximity where he lives in his, I think he can go to the bank and he can go
Just
to
very close by.
yeah. But
Places he's very familiar with.
but as far as the freeway or
Gary takes me, but
as far as the freeway or driving at night, we have concerns.
So you would
Yeah.
pitch in and...
I would help him out instead
A
of
friend,
going-
perhaps.
or a friend, yeah.
Would you call on someone to drive you if you had to go somewhere at night?
well, I wouldn't go unless somebody, a lot of my friends call me and they'll say, well, we're going to the Elks. Well, it's-
And they'll pick you up?
Pick me up, yeah.
Oh, that's
Yeah.
fine.
Oh, yeah, that works out pretty
But
good.
you know, that's our concern. If
I
he
could drive to the Elks the way I go there with my eyes closed.
he's been going there for a long time,
Yeah.
but
40
if
years.
he's having a couple of beers and he's driving home at night,
That could be...
that could be problematic. And I'm afraid that he's going to get in some trouble, and I don't want to see him lose his driving privilege, because I think he can still get by going to the bank
Mm-hmm.
and the market.
Mm-hmm.
He seems capable of doing that.
Mm-hmm.
But it's not just me. I think some of his, you know, family members are concerned about, you know, long distance driving and
Yeah.
night driving, you know.
Oh, yeah.
So you would try to avoid night driving because of the vision and
Yeah.
driving long distances because it might be easy to get lost.
Yeah.
So you would
Yeah.
call on someone to
Oh, I prefer
to act as
I
your
really don't
chauffeur.
And I think, you know, he's got some friends, and I don't know why the Elks, you know, I mean, sometimes they'll pitch in, but not always,
Mhm.
to drive,
Mhm.
you know. But
How far is the Elks Lodge from where you live?
I'm going to say maybe a mile and a half.
No, it's downtown Torrance. It's more like
No, downtown.
it's by the DMV.
Okay.
Yeah, by the
And he lives over by, down Hawthorne by Del Amo.
Mhm.
So what is that, maybe
Few
a few miles?
Okay.
Yeah, but it's
Okay.
just,
Yeah.
but I have the side streets that I can
Yeah, because
take
you've driven
I
it
could,
hundreds and hundreds of times.
yeah, I could
Right,
drive there
right.
in my
You never get lost going
No,
there.
no,
Yeah.
no.
But you don't want to be drinking and driving. That's the other thing.
You're a smart man.
Right.
Because that could be
yeah.
dangerous. Plus, you could definitely lose your license if
Right,
if that
and
happened.
we're
Yeah.
trying to.
If they pull
I
you
got
over.
my license and they're good
Yeah.
for another 4 or
Yeah, he just got it renewed.
Did you?
recently.
You passed the
Yeah.
test okay?
He didn't
Oh,
take a
yeah.
driving test, but you took a
The written test you passed okay?
I don't know, they took my blood pressure or whatever there.
He did the vision test.
Yeah, the
of course, they
vision.
give you
That's
that.
with my driver's license.
But he's good for another 4 years, I
And that's
think.
pretty impressive.
Yeah.
So, the expiration is 2016. So
Another
that's
3
over 3 years.
3 years, yeah.
Almost 3.5 years.
Yeah.
It's pretty good.
Well, I try to take care of myself, and then I have Gary over here that when I need some special things,
Yes.
and I call him, and as you see,
Okay.
he brought me here to do it.
Yeah, which is very nice of
Couldn't
you.
couldn't ask for it.
I just don't want you to get into an accident.
No.
I can check your prostate. We've done it before. I did it last
Yeah.
year, this time.
Hey, you want me to step outside?
You probably don't want to.
Yeah, okay. I had mine checked about a month ago.
You probably haven't done yourself.
Okay.
Let's take a few seconds. So if you stand right here for me, and legs apart, hands down, and elbows on the mat like so, we'll go ahead and do that. And then after that, we're finished. And we're going to go ahead and stick with what you're doing.
Are we good?
Yeah, we're all set.
Okay.
Okay, he passed.
Okay.
You still playing golf?
No, I haven't but I will when the weather gets better.
Okay.
But I'm still going down to the gym 2 or 3 times a week.
Okay,
And
okay.
that's where I good exercise, breathing exercise.
Okay.
What do you recommend for, is there any medicine for breathing other than exercise to try to?
I think exercise is really the safest thing and the most effective thing.
I see.
Did you get the pulmonary test?
Yes, he actually did okay.
Did okay on
He
it?
actually passed those tests.
Yeah.
Yeah, yeah.
Good,
So
good.
there was good lung function.
Good.
Had you been a smoker before?
Oh, many years ago. I haven't been smoking.
But you haven't in many
Not
years?
not for many.
No,
Since my mom
Yeah,
passed
so
away,
the
that-
lung function actually
that was
looked-
maybe 25 years
Yeah,
ago.
the lung function looked good.
Yeah, I seem like I'm running out of breath at my age. You know, you said that's normal. And
Yeah, it could be the heart, you know, because of his heart valve
Right,
issue
right.
that he had.
Right, the shortness of
Being,
breath because of the valve.
Become, you know,
Yeah.
it could be that.
Yeah. Yeah, the neurologist we saw a couple of days ago, and he had the report. Have you seen this yet?
Yeah, this is the CAT scan, yes.
Right.
Yeah.
Boy, I
Okay.
It was okay.
Right.
Nothing dangerous or anything.
Yeah.
Everything would be pretty much expected.
Right.
The brain tissue does shrink as we get older.
Right.
But that's true for everybody.
Right.
Uh,
He said there was evidence that he had a small stroke
Now,
in
let
the
me see
past.
that part.
And so that's, yeah.
Old infarct in left occipital lobe.
And he thought maybe it was tied into when he fell about a year ago in the wind. But, you know, I remembered a few years back that he started to kind of slur his words a little bit. And I
Oh.
thought,
That
you know,
might have had something to do with this.
I said, you know, have you checked your doctor? You know, that's kind of a sign of a stroke.
It could
He
be.
said at the time, he says, no, my doctors say I'm fine, and that he thought it was his dentures need to be tightened up.
I
And I said,
see,
well,
I see.
okay, you know, and it seemed to kind of, it hung around for a while, but it kind of gradually went away.
That could have been a
Yeah.
sign of a stroke.
Sign of it, yeah.
In
That
which
was
case,
maybe-
it often does improve.
Right.
Just on its own.
Yeah, so, and I guess he said, the neurologist said there was no fluid there, so nothing really to worry about, but
Now, instead of old,
Yeah.
you know, they can
they can't.
quantify these in terms
Yeah.
of something brand new.
Yeah.
Now when they say old, they can't tell us how old.
Right.
That's me.
So, yeah, it's like a
So what
scab.
does old mean? You know, it's a relative
Right.
term.
They can't really give you a date on,
They can't.
on something.
But it just it didn't happen within the last couple of weeks.
Right.
You could
Yeah.
probably say that.
Because when he fell, and he went to the emergency room and they
Oh, boy,
checked him
that-
out. They took a picture and they
I-
said there was no real concussion. It was he had a big lump on his head. And he was all
I
black
did.
and blue.
But
Black.
no fractures.
No
or anything
fractures,
like
I
that.
gave you a written report of that when
Yeah.
that would knock you down.
Yeah, so the old stroke, the only thing you'd probably want to do, which you're doing anyway, is keep taking that low-dose aspirin.
Right.
Because there is good evidence now to suggest that it does reduce the
Once you
chance
tell
for
them about
stroke and
that,
heart attack. Not just stroke, heart attack also.
Right.
Both.
Oh, okay.
Both,
Yeah, good,
stroke and
good.
heart attack. So I would and 81 milligrams, I would just stay with that.
Okay.
There's no advantage to going higher, you would think.
Right.
Well, if 81 is good, why not
Yeah.
325?
That's a good
Which
number.
is the
yeah.
standard dose. The problem is it could raise your risk for bleeding.
Right.
So I would stick with the 81 milligrams.
He also suggested
That
coconut oil.
Oh,
You know,
that I'm
and-
not aware of.
Yeah. He said
What's
there
that
was-
supposed to do?
Well, there was a clinical trial that he had referred to
Mhm.
that the coconut oil was very beneficial
For
for the brain
brain function.
function.
Really?
And
I did not know
he
that.
quoted that, and so I brought up the question about, well, I read about that blueberries were fantastic,
Mhm,
the real dense color in the blueberries.
Mhm.
Actually, they've proven in mice and in some human trials that actually was preventative against dementia and actually
Mhm.
could repair some
Mhm.
stuff. And he says, well, he hadn't seen a clinical trial on that
Mhm,
basis,
mhm.
but there's, until he says that he would just be open to.
It's not going to do any harm.
It's not going to hurt you.
Do you like
Coconut.
blueberries?
Oh yeah, but
Do you eat them normally?
Yeah, with my syrup. But that coconut stuff, it's like ice cream. You know, it's
Right.
kind of heavy.
Where do you buy this?
Well, I took him down to Sprouts and got him a little measuring spoon. He said 2 tablespoons
Mhm.
of coconut oil, or 2 teaspoons.
So you
I
just
got a
buy it
little-
in a bottle?
Yeah, it's just a little
You
jar.
just pour it in a
Yeah,
jar.
well, it's got a coconut.
Yeah,
You got
it's not oil.
coconut
It's
flavor.
like ice cream. You know.
Oh, is it?
or like a white peanut butter is more like
Oh,
it.
Yeah.
really? You
And-
mean it's a solid?
Right.
Yeah.
Well, if it's warmed up, it will be like an oil. Like
Oh,
like
okay.
olive
So
oil.
it'll
It has-
liquefy.
It'll liquefy.
Oh,
But he
it
was
has-
saying that because there's these long chain fatty acids and short chain fatty acids, and then coconut oil seems to be a medium chain fatty acid,
Mhm, mhm.
and that was beneficial to the
Interesting.
neurological thing.
You know what? Maybe I should start
Yeah,
that.
that's what I said.
Sprouts, huh?
Yeah.
If you don't,
Maybe I'll see you there tonight.
So anyhow, we got them all
Maybe I
set
should
up.
try that.
We got them all set up, and they have coconut flavor. They got neutral flavor and coconut flavor. Put some between a graham cracker, and it's like
Uh-huh.
a cookie. You know.
Amazing.
Well,
So you do that once a
Well,
day?
he started that 2 days ago.
Once a day?
Once a day.
Once
yeah.
a
The 2 teaspoons
Yeah,
once a day?
Yeah. So hopefully.
Anyway, doctor, I'm so happy that you gave me this report.
You had a great
because I
report
thank God.
today. I didn't find
And,
anything
yeah.
new on the exam.
And at 3 o'clock today, you remember Rush, what's his name, Jerry
Jerry Buss.
Mhm.
At 3 o'clock today.
They're having a memorial.
Celebration.
That's right,
memorial.
yeah.
Yeah.
But we weren't invited. It was
No.
not open to the public.
They're actually
but they're
gonna-
going to be televised.
They're going to televise it,
Yeah,
so they
that's gonna be
broadcast it this
televised.
afternoon.
Are you a Lakers fan?
Hell yes.
Oh, then you.
But,
What
I
time?
saw-
3 o'clock. Oh, you
yeah.
better
I
get
just-
going.
I just barely-
One other thing I wanted to ask you about, when he was the ear, nose, and throat guy down the road, they took a hearing test,
Mhm.
and he's got some hearing loss, and it's age-related,
Mhm.
but they said that he had difficulty hearing vowels. Consonants. He could hear the vowels, but not the consonants, and that we're thinking that maybe some of his, it might be confusing if it's, you were talking about mental, maybe he's not hearing the question
Mhm,
or the
mhm,
words
mhm.
in the conversation.
Mhm.
That might be contributing to some
It
of
could
this
be, it could
thing.
be.
So, but
Yes.
he's not very eager to go out and
That's
get
fine.
fitted for hearing aids.
Did they say he
right
would
away.
based on the results,
they-
would he qualify
Yes,
for a hearing
they
aid?
wanted him to get, she said she
Oh.
wanted him to get hearing aids.
Oh.
And I know they're expensive, and
They
would
are
have to be,
expensive.
they would have to be fitted.
Mhm.
But he wasn't really eager to go get them right away. So
What do you
there
think
might-
about hearing aids for yourself?
Well, at my age, I'll tell you, I think I hear just about, about as well as
you want to?
Yeah, and I want
He likes
to-
Maybe the things that you don't want to hear.
I like to hear Lawrence Welch.
Yeah,
But what about the TV? Like, you're going to be going
Yeah,
home and
I-
watching TV.
oh, I can
Will you
hear-
be able to hear
oh,
the
yeah,
volume?
yeah.
Now, do you have to tell your dad, gee, can you lower the volume? It's awfully loud.
No,
I mean, is there...
it doesn't seem to be a volume thing. They did a really interesting test, and I had taken a lot of hearing tests down at the airport because I worked around that stuff all the time. They gave him a very thorough test. And they did a funny test on him where they say words, and he had to repeat the words back to him, and
Yeah,
if
paper.
how correctly that he said them, and he didn't get all of them. So there's a thing about
already-
so some of the communication is breaking down, not in volume, but in vowel consonant.
I see, I see.
And so that's why he would be fitted for something that might help him.
Oh, I see, I
with-
see. So it wouldn't be the
Yeah.
conventional volume issue.
No.
Right,
Oh.
right,
What
right.
is it? I'm supposed to see you in a couple of days,
Yeah.
maybe? Or
Well, I'm going to see you back in 6 months. We've
6
been
months, yeah.
sticking with that so I can keep an eye
6
on,
months. Oh,
see how
okay.
you're doing, check your labs again, keep an eye
Yeah,
on your
right,
okay.
cholesterol.
All right.
And we'll go ahead and schedule that out at the desk.
Okay.
But otherwise, I wouldn't change anything. I would keep doing what you're doing. 'Cause
You know-
something's working, you know.
How
could I
I
ask
mean,
for
based,
a
based on those results,
He's got good
I
results.
mean, you must be doing something right.
Right, exactly, yeah.
All right.
Doctor, I'm so happy that
I just don't want you to get into an accident.
I'm
that's
not
all.
going to do that.
Yeah.
I think too much of you.
Okay.
Let me know on my next.
Yeah, they should be able to look on the computer and tell you whatever your next appointment, because I think you've got something set up next week.
What was it I was talking about next?
You had something on your calendar.
But something.